Hello, welcome back. I'm Folake Lawal, board certified physician and your host here on Doodles MD. Welcome back to the second part of the reproductive system on the Know Your Body series. This week, we will wrap up this system with the male genital and reproductive system. So the male genital and reproductive system, the formation of it begins in the womb when the fetus is about between 6 to 12 weeks. And the masculinization, which is the process of forming the male genital, actually requires the presence of a complete Y chromosome. Note that word, a complete Y chromosome, and when we get into the disorders, we'll talk about people who have Y chromosomes that are missing an essential piece and they develop conditions like androgen insensitivity syndrome, and everything looks like a female, but on the inside they have testes and things. But this process occurs from the testes, the embryonic testes, producing testosterone, and then between the 6 to 12 weeks, things are formed to look like a male, and that's why they're able to tell on ultrasound sometimes the gender of the child. By the second trimester, this testis becomes inactive and is no longer producing testosterone, and so the testis becomes inactive till puberty. Other testosterone that's produced afterwards is now produced from the adrenal glands, which we talked about in the endocrine system. So going to the function of the male reproductive system, very simple. Two things. One, to produce male sex hormones, which is necessary for sexual maturation at puberty, and of course for reproduction after puberty. There's some other things adjoining that the hormone does, like, helps to increase muscle bulk and bone density in men and all of that, but those are side attractions. The second main function is production of sperm cells, which is the male gamete that fuses with the female gamete, the ovum, to form the embryo, which becomes a baby. So those are the two main functions of the male reproductive system. All right, so we're here now to talk about the structure and the parts of the male reproductive system. First of all, I wanted to show us a comparison of some things with the female. We can see the large intestine and the anus on both sides here. The bladder is this triangular organ that we can see on both sides, and in the female you can see that the exit, the tube that empties the bladder, is separate from the vagina. However, in the men, you can see that tract, the urethra, goes into the penis, and that one that connects from the testis joins with it. So we'll talk about how they alternate and they work there. Here we're going to talk about the external male genitalia, and this, if you focus on this circle or ovoid here, this red ovoid, it just highlights the penis and the scrotum, and that's essentially the external. The penis has the root, which is mostly on the inside of the pelvis, and then there's the body of the penis, and there is the glands, which forms the head. The glands which is the light pink down here, and this is the one that carries the urethra, where urine and semen travel through. The light purple up here is called a corpus cavernosa or cavernosum. It's a sponge-like tissue that can contract and shrink down and of course expand. When there's sexual stimulation, it fills up with blood. Blood rushes there and there's room for it to fill up, and that's what is responsible for erection. Here, the glands here, as you can see, which is the head, and it has this inverted rectangular shape, is what is equivalent to the clitoris in women. The only difference is that the urethral opening is outside of the clitoris. It's very close to it, but it's outside of it. It's not inside. The other part of the external genitalia is the scrotum. The scrotum has the scrotal sac and then the content of the scrotal sac. So the scrotal sac has the skin. There is like different layers on the inside before you get to the content itself. And one of the layers is a contractile tissue, muscular tissue that can contract and relax, allowing for, when the testis relaxes and when it shrinks up for temperature reasons or stimulation. On the inside also we can see the testis, and then the testis connects and empties into the epididymis, and that connects into the spermatic cord that travels up. So these are the things that form part of the external genitalia. On the internal side of things, let's start from the testis. So this is a cut section of the testis. You can see different chambers, and this label of seminiferous tubules is inside of this is where the sperm cell is formed. And this here, we remember we talked about hormones coming from the brain, right? Stimulating the stimulating the organs. So here we have the LH and the FSH, just like we have in women. The FSH is responsible for follicles in women, and in this case in men it's responsible for division of the sex precursor cells to form the sperm. The LH is responsible for formation of the hormone. Okay, so those are formed inside the seminiferous tubules, and they travel, the semen, the sperm, and the are immature, and they travel into the epididymis. They are stored in here, and they also mature in the epididymis. When they mature, when there is sexual stimulation, again, there's a contraction that squeezes them out into the spermatic cord. Okay, and it squeezes them into the spermatic cord. So when we come to the left side here, so it comes the spermatic cord, and then it travels up and it joins, it comes here. Now on this here is what we call the seminal vesicle. This is a gland that produces sugar-rich fluid, fructose-rich fluid, that is what gives energy to the sperm when they are traveling. These join, so the sperm cells and the fluid join in the prostate gland. The prostate gland also provides some nutrient-rich fluid, okay? And so here, and they join, right? Now you can see here that the bladder is here. This is the neck of the bladder, and you're wondering how things don't mix. So the bladder itself has, opening and closing, or what we call a sphincter, which is like a lock, a muscular lock. So when there is sexual stimulation, that stimulus that stimulates you to produce all of this, reproductive thing, closes off the bladder. However, you might have some urine down already in the tract, and that is what this Cowper's gland is for. This, when it produces a clear, it looks like water, like Sprite, but it's slippery, and this is what cleanses out urine from the tract, because the urine is acidic and it will kill the sperm cell, right? So this first of all goes first, cleanses out the space, and then when there is ejaculation, the semen the semen comes through, which is a mixture of the fluid from the seminal fluid and the sperm, and it comes through here and down, and it is ejaculated. Now, one thing to note is that the testis, okay, the testis actually starts in the formation of it, starts inside the belly, somewhere around the top here, okay, just like in the women where the ovary is also in the lower part of the belly. And when the child is still in the womb, it begins to travel down. So it doesn't, instead of going from behind, there's a lot of things going on. It goes through the front and it travels through the side and of the groin, which is when you fold your leg, that crack line in between, and then it comes into the testis and it drops. When the testis doesn't drop early, it poses a risk for cancer in children. So that's why you have this spermatic cord that's curving all the way. It's very long, and then it's curving all the way over the bladder and down into the scrotum. So even though this is like a very oversimplified overview of the male reproductive system, one of the things is, like I mentioned, the sperm production here inside the testis is remarkable. That the testis makes about 1,500 sperm cells per second, and in a milliliter of semen there is between 20 to 300 million cells there, and every ejaculation is between 2 to 5 mils normally. Of course, it can be more, it can be less, and those are considered abnormalities. So that's just essentially just a very simple overview, and we will pin right there for now. Thank you for tuning in. So we've talked a lot, last week and this week, and some fun things about, just the reproductive system, and understanding a bit more how these things come to happen, and, forming a baby and how a baby is formed and all of that. Next week and next episode, we are going to be talking about the nervous system, which is the brain and the nerves. And that is a very complex system, but I'll do my best to break it down. While you're still here, please like this video and subscribe to our channel. Follow us on our other social media handles with the links posted below. And of course, share this video with your family and friends. We'd love to have them on board too. See you next week on Doodles MD. Till then, I'm Falake Lawal. Make sure you have a lovely weekend. Bye.